Dog holds. Good dog handling skills equate with safety for both the dog and the handler. At HQHVSN clinics, good skills are even more important as there are no other visits in which to build trust with a patient. Many patients are fearful as they are arriving at a strange place, brimming with other dogs, and likely had a long ride to get there. We strive to keep them as calm and secure feeling as possible. Greeting a dog. This is the first impression you will make on the patient. Do it as correctly as possible, given the limitations of patient processing. Approach each patient in a calm and confident manner. Speak in a happy, joyful voice. Pay attention to recognizing signs of nervousness and fear, such as the dog looking away from you, panting, yawning, holding ears back, or cowering. Approach the dog with your side or even your back as opposed to facing the dog head-on. Kneel next to the dog rather than bending or leaning over the dog. Avoid grabbing at the patient and instead encourage the patient to come to you. Controlling the movement. One way to prevent escalating arousal is to control the dog's movement. As soon as you take a dog from their owner, keep the leash short to prevent the dog from pacing around anxiously. Walk with purpose and do not look at the dog. Encourage the dog to walk with you in a happy and confident voice. Keep the dog close and even hold the leash and collar if standing and waiting. If necessary, place the collar and leash in one hand and place the other hand on the dog's hip to press her against your leg. Restraining for an exam in a standing or sitting position. Always keep your hands on your patient, particularly on elevated surfaces. Be ready for them to make sudden movements, jump, or spring up. Stay alert to prevent them from injuring themselves or escaping. Provide maximum body surface contact with the dog. This helps them to feel secure and supported and allows you as the handler to control movement. Place one arm underneath and around the dog's neck. There are 3 gradations for the security of this hold, depending on the temperament of the dog. For a calm, happy dog that requires less restraint, letting the neck rest on the forearm or in the crook of the elbow may be sufficient. This position does allow them more freedom of movement. The more restrictive hold would require the handler to turn the palm of the arm encircling the neck to face outward while keeping the arm just behind the dog's skull. The most restrictive of the 3 holding positions also requires the least amount of strength on the part of the handler. In this hold, the handler closes the circle by placing her hand on the back of her head or neck. The dog at this point cannot turn her head back to bite or snap. The other arm should be under the dog's abdomen or chest in a manner which keeps the dog from backing out of the hold. Restraint and stabilization for cephalic venipuncture. While controlling the head as previously discussed, hold the dog close to your body with your outside arm. With the hand of that arm, hold off the vein with your thumb and place your fingers and hand behind the elbow to keep the dog from pulling back the leg. Another method would be to hold off the vein with 2 fingers and place the thumb behind the dog's elbow. Practice both until you are comfortable. Further restraint. A large thick towel may be used to help safely restrain a dog, particularly if she is smaller. There are several options for this. The towel may be rolled lengthwise and held tightly behind the dog's skull where the ends meet after passing under the neck. The towel may also be folded lengthwise and even held tightly with one hand. Placing a muzzle is an important skill. Practice muzzle placement often on friendly dogs so that you can perform the placement in one smooth motion. Fumbling will likely increase the dog's anxiety, which may increase aggression and will likely make the entire process more difficult. Place the muzzle from behind the dog. Approaching the dog head-on will be intimidating and may increase aggression or cause the dog to back away. If standing behind the dog, this will aid in stabilizing her in one place. Have a helper hold the head straight and, using 2 hands, slip the muzzle over the nose. Slide your hands back on the straps and then tighten the straps behind the dog's ears. For further information on how to train a dog to willingly accept a muzzle, please refer to Sophia Yin. Here are some other suggestions to decrease stress in a clinic. Remember that each clinic is unique and will require your staff's effort to further improve patient stress and anxiety.